Time to get started. My name is John Decker, the Director of Community Services at Alta California Regional Center. This is our weekly vendor meeting, Coffee with Community Services. Excuse me. So just introduce some folks that we have here. I see Gary, Community Services Specialist. Good morning, Gary. And I see Gino Nessie wearing her logo wear from Alta California Regional Center. Yes, very good. And one of our community services managers.
Thanks to John, Christmas present. Lovely.
And good morning, Carol, our SLS and Debt Services Manager. And we have Jordan Eller, number one of our community services managers as well. And Olivia Procida. Good morning, Olivia, too. And my assistant, Zach, is here, as is Kelsey Rainey and Denise Hopkins. Look at that. There's so many staff joining. I'm not going to be able to keep up. Jason is here as well. Good morning, Jason. All right. So we'll get into what we're looking for as far as agenda items here today. We're going to be just giving a brief update related to EVV, electronic visit verification. Olivia is going to give us a little update on the activities related to the rate study, kind of where Alta's at. We're going to talk about the specialist positions at the regional center, and we also have a new health and safety waiver specialist position that we're going to be describing to folks as well. If you've been in any budget hearings or you reviewed the budget from last year, you'd be familiar with the health and safety waiver assistance for non-English speaking consumers. So we're going to talk about that a little bit. And additionally, we were talking about upcoming vendor forums, discuss our upcoming newsletter, a little update about PPE, an update on our return of our staff primarily back into the offices, and then a little discussion about alternative services as well. And I will also welcome Heidi this morning. Hello, Heidi, from our Grass Valley office. All right. It's always nice to have our client services managers in here as well to kind of hear the new news and what's going on. So to start off with, some of you are have service codes that utilize the electronic visit verification effective in January. So as you will see, when we get notices from DDS, we will be forwarding those along from Christine, our office assistant in the community services department. So if you are not receiving notifications, like for example, she sent out a notification this morning related to EVV, and you are a vendor that does EVV, or you want to receive the email, and maybe one of your staff got the email instead, you can reach out directly to Christine at chobbs@altaregional.org, and she can look to add you to that distribution list. Because DDS is sending out so much stuff related to this, we just want to make sure that you guys are getting all the technical assistance that you need. Certainly having Jennifer Parsons here and having her spend so much time answering questions and going through the whole process with you guys, I think was certainly helpful. But I know that there are others that are still kind of struggling with this or kind of figuring out how they're going to get going with it. So with that being said, we will continue to be sending this out to our service providers when we receive the information from DDS. I want to create an opportunity for folks as we go through some of these agenda items, and like, for example, with EVV, if there is a specific question that you have related to EVV and you haven't been able to get it answered, you're welcome to drop it in the chat box right now, because we've got a bunch of our staff right here. And so we've got our staff that can grab your question, try to see if we can get it answered for you. We can certainly help. I know Carol had a question, a couple weeks ago about EVV, I think it was, and we were able to get the question over to DDS, find out what the answer was, and then get it back. And so again, DDS I've found have been really responsive to us. If we ask them questions, I'm hoping that they're responsive when you guys are sending into that EVV inbox, but just want to make sure that you guys recognize that this is a resource for you. If you need it, please put your question in the chat, and we would be happy to try to get that information back over to DDS and get an answer for you if it's something that we're not familiar with. So if there's not any questions specifically about EVV, I wonder if we could, I will say first, that we have certainly seen a continued drop in our COVID cases at the regional center. We're back down to, smaller single digit number reporting during the day, every day, as opposed to, dozens, 50, 60 or more clients in a day, which is what we were reporting, kind of towards the end of January, beginning of February. February was certainly just a really challenging month for a lot of our service providers. I think that is a message that I heard from a lot of folks coming out of the back end of the Omicron surge and dealing with continued hiring challenges for the agencies. So again, we are seeing those numbers dropping. We are certainly seeing that, we're not hearing as, of the big outbreaks, but we're still, just, I guess, Monday of last week or Monday of this week, we had a facility, and that all the facility and all the staff tested positive. So these things are certainly still going on in our community. We were able to get a delivery of PPE. We went and picked up PPE and brought it to the regional center from Sonoma so that we could distribute some for you all. There was some more that we wanted to get, and we were waiting on a DDS delivery for the second half. And right now we've got some N95s, but we're hoping to get more surgical masks in as well. So I will be reaching out, and Michelle Johnson and I have not been able to create the kind of delivery schedule yet, but hopefully we'll be able to get that delivery schedule set up so that we can start providing, I think primarily for you all as service providers, N95s seem to be what the biggest kind of demand is. And so we'll work at getting those ones distributed to you all as well. So with that being said, a lot of our activities and our poor community services specialists have been certainly working very hard on this, has been related to the rate study. So we've had several meetings over the last couple of days related to this. So I'm going to have Olivia try to do the very best to kind of synthesize where we are at with the rate study, with the batches and everything else.
I'll do my best. So we have submitted batch 1, 2, and 3 of questions from DDS about service providers and the rates and what they are. So we submitted those. We have batch 4 that we're submitting on Monday. We did meet with the DDS this week for SLS to just kind of, so they could have a better understanding of the breakdown for our SLS rates. It sounds like SLS rates, like so many other rates, are done very differently at each regional center. So I think just meeting and having that conversation so we make sure we get these right. Along with that, I believe it was yesterday, we actually received our first batch of actual rates and what the rate adjustments will be. So John, Jean, and I took a look at those and kind of had a couple questions if there were any outliers so that we could return those to DDS for that. And then we're working with our accounting department on what the communication to providers will be. We know that you'll get a rate letter, but I believe someone brought up in one of these meetings a couple months back, it was either Adrian or Kate, said that they thought there was going to be some sort of like an appeal process or something about the rate after they receive it, but we don't have any information about what that looks like yet. So stay tuned, but we're going to work with Robin and Iqbal. They've been amazing about how to get that information out to the providers as soon as it's official and we're good to go. How was that, John? We got everything?
That was very concise. A couple things I want to highlight about what Olivia said was, first, you heard that Olivia and Jean and myself are actually looking at every single rate. So that's our plan, is that though we had our specialists working on a lot of this stuff, we are kind of doing a management last double check to make sure that everything was done correctly. And we found a couple things that were things that need to be modified. So for example, we had some rate increases that looked a little strange because it really should have been a 1-to-2 rate, and it's marked down as a 1-to-1 rate, for example. And so that's some of the stuff that we are kind of doing one last kind of troubleshooting look at to finalize them. And so I know we're finalizing batch 1 today, and then I would say for many of you participate in our provider advisory committee, you should expect that we can provide an update at the upcoming provider advisory committee, which I believe is next Thursday, on what the communication is going to look like between the regional center and the vendors now that we have kind of settled on what some of the rates are. Again, until we get through all the batches, that's when all the vendors would be able to have that. But it makes sense to us that if we have batch 1 done and we've gone through to double check it with our managers and our accounting folks, that I wouldn't want to have to wait until we get through all the 4 batches to start having that information shared with you guys, because otherwise we're not going to have the ability to make any changes in advance of when the billing is supposed to start. So let's see here. I know Iqbal and I are going to be talking about that and trying to also figure out from DDS and other regional centers, because that's one thing as well. Many of you also work with other regional centers, and I think there should be some consistency for related to this. I almost said for once, but that would not be fair. But there should certainly be some consistency that our providers see from different regional centers as how we're sharing this information related to your rates with you. So I think that's Iqbal's desire as well, is for us to get on the same page with the other regional centers. And again, I feel like we can, excuse me, I feel like we can be able to at least provide an update on it when we discuss it with the PAC next week. And then certainly in this meeting, which is the day after that, we can certainly give an update here as well. In the chat, there is a note: the rate model released does not have a 1-to-1 rate for 055, which has been eliminated, or is it included in what ACRC has access to? So I don't know what the status is with the 055s and what those look like on the or which batch that they were in. Was there a 1-to-1 rate that, or have we seen those? No, Olivia?
Yeah, so Catherine, you are correct. The information we received, it was 1 to 2 or more intensive, I think was the word that it used, words that it used. Thanks, Jason, for confirming that. And we have not received those back from DDS at this time.
So we will certainly have a much better idea about those ones once we figure out exactly what that looks like. But that again is something that I'd like to be able to, like, we meet with you guys so frequently. It'd be great to be able to share with you guys a little bit more as, again, we get the at least what are supposed to be the final rates back from DDS. So just know that that's our commitment. We're just confirming them right now, literally for batch 1. Like there's still a few even to do. But again, next week we'll have, I think, a much better update for folks on that. And a lot of batch 1 vendors also were vendors from outside of our catchment area. So like for most of you, you're going to be in like batches 2, 3, and 4. And so we're still a little ways out, I think, time frame wise. When I mean a little ways, I think maybe just in the next few weeks about getting those rates. Other questions about the rate study? What we saw is a calculation that makes pretty good sense to us, which is a column that indicates what your current rate is, a column that indicates what the rate is, the benchmark rate is, so the rate that they've established through the rate study that it's going to be. Then there is a column that has what your dollar increase amount will in essence be. So if, for example, in April, you're looking at a $4 increase or something like that. And then the final column has what your new rate is. So your new rate, if you're above the benchmark rate, your new rate effective April was the same rate that you have right now. So for some of you that have ILS programs and you recognize that your rates might be a little bit higher than what you see as the benchmark rate that DDS has put out there, you're not looking at a rate decrease through all of this. You're just not going to see a rate increase right now. And it's not just, and that's the way it works across all the service providers. So I think DDS did a really good job explaining that no one is getting their rates lowered at this time, and that the rate methodologies are not going to be changing at the time. So if 055s are going away, and we're figuring out whether an 055 is a site-based type of service or a fully community-based type of service, and figuring out the extent to which that's going to impact your rate, that is not going to, it will not lower anyone's rates effective next month. There is the hold harmless clause that's in place. That being said, for those that are looking at speeding up the rate study, and maybe there might be someone in this meeting that is familiar with this, is there any thought of the impact that might have on people that, like, are we also looking at the hold harmless clause being removed as well? Or because that would kind of speed that up, I would assume, if the rate the rate study was implemented faster. So has anyone heard any discussion about that in any meetings?
Hey, John, it's Andrea from Alliance.
Hey, Andrea.
Yeah, I think that the hold harmless, we're looking at that as well as the hold harmless, at least the things I've heard or even putting out there, like there's still time to advocate for that, even in speeding up the current rate study.
Because that would be a little bit of a, I mean, for some kind of shooting themselves in the foot a little bit. I feel like if we, you know, if that hold harmless, you know, gets expedited the same way services do. But I do see that we have a comment here. We're simultaneously asking for the hold harmless to be made permanent in the chat. So,
and there's also something out to look at the rates every few years, which would then potentially, as things increase anyway, could make everyone have an increase. I don't know. I'm just talking.
So you're thinking that we should keep up with the cost of living and inflation? Are you crazy?
Just crazy thought of potentially that being an ongoing conversation. Just, you know, imagine that.
Like the way other businesses work? All right. Well, Eric, I saw your hand raised there as well. Do you have a comment about that too?
Yeah, just in addition to hold harmless, there's adjustments that we argue that need to be made to the rate study that not, you mentioned ILS. So I think those kind of go hand in hand, that either you keep the hold harmless indefinitely, or at least keep that for a period of time while we're able to modify and update the rate study, or I should say correct the rate study on key service areas. So those would go hand in hand.
I will say that I never stop advocating for you transportation providers. So all those things that we heard Eric say and the rest of you say related to your concerns about transportation, and if there is a single trip rate set up for transportation, that we're going to lose out on services possibly, you know, for our very large catchment area that we have, and we're going to create even greater disparities for some clients and families that aren't able to get access to services. So I will say that I took the opportunity when DDS asked us to meet about SLS to bring that up with them. I brought it up with Burns and Associates, and I brought it up with the chief of the rates section over at DDS as well. There is not an answer to that. I think that was the answer that we got back, was that these are issues that have been put forth to DDS, and right now there does not appear to be a solution to them. And so I, you know, mentioned that you know, we have vendors that we're going to be providing some feedback, you know, specifically related to that. But again, just wanted to share, you know, that's why we do vendor forums with you all as well, so that you can let us know the things that are important to you, that you want us to advocate on your behalf to DDS about. And, you know, it was a perfect opportunity because Olivia and I think, had to wait a little bit before everyone joined the meeting. And so we were able to get some time to talk with them specifically about the transportation stuff as well. Michelle, I see your hand up. Yeah, go ahead.
Yeah, I was just curious, just this SLS question. I looked at the rate, we've been looking at the rate models that were originally put out in 19 and then fixed in 2020 for SLS. And I'm assuming that there's no more of this breakdown of sleep versus PA anymore. It's just going to be a flat SLS rate. Is that correct? $1.
Olivia, I'll let Olivia answer that one since she spent time doing that rate study, but that sounds like what it looks like. It's just that the rates all needed to be broken apart because each regional center has been vendoring SLS providers however they wanted to for the last however long. And so unbundling those rates, figuring out, you know, what constitutes $32 an hour, like what positions and what is, you know, what activities and things like that. And poor Carol even had to get dragged into the meeting to help explain things to the financial folks as well. So I think that's why it's hard for us to give a preview for folks, because we don't know exactly, like, until we see how it gets applied when the rate comes back, like, we're not going to know yet. Is that right, Olivia, would you say?
Yes, that's exactly right.
All right, Andrea, I saw your hand come up and then went right back down.
Yeah, I think Olivia just answered it, because I was just going to add on to Michelle's question as far as the, you know, we have that the flat admin rate as far as that, how, you know, with the sleep awake and the admin, and I assume that would go away and turn into just hourly, but sounds like not sure.
I mean, we know that the rate study is really hardly focused on, you know, salaries and benefits for the direct, you know, care staff. We certainly know that those were really weighted highly, but I think we just, like, that one to me, SLS was transportation. Like, some of those ones are the ones where I'm really curious exactly what they're planning on making it look like when we get them. Michelle, your hand is up. Yes, go ahead.
Yeah. I have one more question, and then this goes for all rates that have 1-to-1, 1-to-2, or 1-to-3. So when you your 1-to-1 rate, I assume that the 1-to-2, 1-to-3 rates are automatically updated as well.
Yeah, so what we received back was a sheet showing what the benchmark rates are at a 1-to-1, at a 1-to-2, and a 1-to-3. So for like ILS, right? That was one of the ones, right? Independent living programs. That was the one where we saw the 3 different rates. And then we saw some service providers where it had inaccurately said we're like, oh my gosh, why is this provider getting a huge rate increase? And we realized that it was because they're really supposed to have a 1-to-2 rate and not a 1-to-1 rate. And it required us doing another look at it to make sure. So stay tuned for that one. I think that would probably predicate us doing an SLS vendor forum so that we can really go over with you all once we kind of get it done. So Olivia, and I know Carol will mentally prepare herself to also, that's right, be there and answer questions and everything once we get those rates back for SLS. Again, I think it's just also when you look at how every regional center's kind of description of SLS and ILS looks a little bit different as well. Figuring out statewide rates off of that, again, hopefully as quickly as possible, we will give opportunities for you guys to review these things and realize, you know, whether or not you're looking at an increase right now and what that will be or not. So stay tuned on that. The rate study is certainly going to keep us busy, especially now that I've committed Olivia and Jean and I to actually reviewing all of these. But I think, I mean, you guys want a high level review done of these to make sure that we don't miss anything. It'll save you guys a lot of work of us sending them out to you and you guys saying, oh, this isn't correct. You know, this is the wrong type of rate. So, and we're going to spare Jordan from having to do this too much right now since she's got so many other things that are on her plate. Okay, anything else related to the rate study? Any questions that you guys want us to ask DDS related to the rate study? Like, I think DDS is probably going to be coming back to us again with more questions. So, and always know that you can email us as well. You know, you guys can email Olivia, you can email Jean, you can email me, you can email Jordan, you know, your specialist, if you have specific questions, because the rate study is important to you guys. And, you know, I joined the regional center when we were at a 4.25% rate reduction for you guys, which was not a fun time to be a service provider for our regional center. And it was not fun to be in community services and to have to do 4.25% reductions. I remember when all those letters went out. So, you know, being able to increase some rates from folks is certainly, I think, where we want to be. I know, gosh, can we even talk about yet like like the 109 rate? I mean, those rates are published, right? So, I mean, we know that we're looking at supplemental services now at $28 an hour as opposed to like, what is it, 14 previously?
1061.
1061. So that'll help. We have like way less health and safety waivers that we've been having to do. So even something as simple as that will make a huge workload difference on us if we're able to, you know, give out those supplemental staffing rates at a rate where you can actually pay people and cover the cost of the overhead for having their positions. So, which has not been the case unless you've had a health and safety waiver for, I don't know when $10 cut it, but it was a long time ago, a long time ago in our system where that covered the cost of supplemental staffing. So that's kind of where we're at with the rate study. We'll get back with you guys and make sure that we keep you updated on things. We are hiring different specialists at our regional center. And so you guys have met Hewitt multiple times. He's our emergency coordinator for our regional center. We have participant choice specialists. I think we've hired either 2 or 3. I think 2 are hired, and I think the third one might be through the process or in the process right now, which is great because, and we also have hired the deaf and hard of hearing specialist. And so, again, I think we are at a point where, you know, we're getting these folks hired and starting their jobs, and I think that's great. With that being said, there was also an additional position that was shared through last year's budget, and that is a health and safety waiver assistance for non-English speaking consumers. And so we got a directive that was sent out from the department related to this, and high level overview-ish. Let's see. Can you guys see my screen okay with DDS's directive related to this? Whoops.
Yes, we can.
All right. Thank you, Jordan. So again, in this case, DDS is giving us a very good idea of how we can ensure that we are following the requirements in the budget by laying out exactly the job duties that they expect from the staff that we hire, which is very helpful. And we'll make sure that I'm sure that we you know, do all the activities in order to support the budget policy measure. So with that being said, Jordan, do you want to give kind of a high level idea about what this person will be working on?
Yes, so I know John's sharing his screen so you can see that, but the health and safety waiver specialist is going to be looking at how we could use, right, health and safety waiver requests to really meet the need of clients and families that are having an issue to access to services, right? We really want to use this position to reach out to our community, really see where their needs are, and really help improve client outcomes. So there's we actually have somebody that we've offered the position to. They're in background checked. And this individual, I think, I'm sure they're going to pass, but is very, very motivated about working with underprivileged communities and providing better access service. So we are really excited about this position. We will also be working with our cultural specialist on some of this to pair up and do some work. So we're really looking forward to it.
Awesome. So, Jordan will be directly supervising this position. We do a lot of health and safety waivers, and one of the benefits is that, we've got one of our previous staff, Andy Perez, who is the person that receives the health and safety waivers over at DDS and works really closely with our staff. But there's, we're a growing agency. We just went from about 500 employees to about 550 employees in the last, a year or so. And I think we started 24 new employees just on Tuesday at our regional center, which is the most that we've ever started in at one time. For us, at least, we're starting to see more, and I don't know how this is, going with you all, but we're starting to see more applicants. The people are starting to apply for the jobs, and we're starting to get more applicants. And I really hope that this is indicative of things to come for you all as well, because it's great if we have a bunch of staff, but that doesn't really help our clients if you guys don't have your staff. And so I will ask Johnny, though, since Johnny's joined us, one of our associate client services directors. Good morning, Johnny. Hey, have we hired our third participant choice specialist yet, Johnny?
That person is going through background. And so, we're excited, hopefully be able to get that person to start April 1st. As maybe some of you may be aware, we also do like mid-month now. So if all goes well, maybe mid March. Who knows? So
They do not know that, Johnny. So can you explain, Johnny, a little bit about the mid-month thing? Because they have not heard about that.
Oh, okay. All right. So we typically start our new staff, new hires at the beginning of first day of each month. What we've now looked at is that we made some changes where we can have some staff start mid-month. And it may not necessarily be a full-blown, what we call ACRCU, but we can get an individual that's gone through background check, clear, ready to start, begin mid-month, working with the manager, the supervisor that's assigned to that person, and then have them start with or continue on with the rest of the other new hires the following month, first day of the month for the rest of the new hires that begin that particular month. So a little bit of options there. For a long time. I know when I started, I started, first work day of the month. And so it's changed a little bit. So which is good. We have a little bit of options there now.
After losing, I don't know how many employees in the process of us liking them and them saying they want to take the job and then them getting another job, and how long it took for them to start with us. We want to try to overcome any barriers that exist for us to be able to bring on new staff. And so if I was a client services manager still, and I certainly am, it impacts me still, even as a director, I would be so happy to know that I'd be able to get my staff in earlier, because there's a desperate need. We're growing. I typically say in our presentations, we grow at 1,000 clients net annually, but last year we actually netted 1,300 new clients. So that's huge. We had a meeting a little bit earlier this week with the city of Sacramento, looking at doing some partnerships with the recreation and parks to expand social recreation. And, it's all the same folks, or some of the same folks. Jenny's been there forever with city of Sacramento. But the last time she worked with us, we had 13,000 people at our regional center that we served, maybe 14,000. Now we're at 27,000 and growing. And so it just shows, we are growing and growing and growing so fast. And we really need all of the supports. Otherwise, these caseloads get through the roof, and then we have less and less kind of personalized services and supports that we're offering through case management. And so I am really happy to see that we are starting to get more applicants for positions. We're starting to be able to bring in some people. We have we're going to have some new managers, and I think one thing I'm going to propose to our associate client services directors is maybe when we get our new managers that get promoted, maybe we'll have them come here and introduce themselves to you all as service providers, because sometimes you may have experience working, with a service coordinator before they become a manager, but sometimes you don't, and they are new folks. So Dana is one, not a new manager anymore, but one that certainly comes in here, and the hope is that when you interact with these folks, or like Heidi or Carol or any of the client services managers, that you have another opportunity to kind of interact with them other than maybe in a contentious meeting, because sometimes that's not the best way to, your whole relationship shouldn't be those types of things. And so I'll talk more with our client services staff about this, but again, I'm pleased to see we're getting some new managers hired and some new staff hired. And again, we certainly need it, because I think we shared with folks, I think we were down 70 staff total in order to get caseloads where they needed to be. And so that's a lot. That means that we still haven't quite hired yet all the ones that we needed, and then we still have additional growth for next fiscal year that we have to look at in expanding as well. So with that being said, we're excited about it and looking forward to onboarding more of our folks. And we will, for the health and safety waiver position, I think that's one where we will, I think we're going to be developing a plan that has to get sent back to DDS within 45 days related to how the utilization is going to look like. But you can expect that we'll be transparent about that plan. We'll have an opportunity to maybe present the plan to you guys, whether we do that in a provider advisory committee meeting down the road, or maybe we do it in here as well. I know we specifically talked about a health and safety waiver primer for you guys, and folks were really interested in that. What was neat about it is that Dan Kilmer has already kind of started working on the document related to health and safety waivers, and then DDS sent us this directive, which says, we want you to create a document that shows how to do health and safety waivers and translate it into Spanish. So it really, we're really kind of a little bit of a head start on a few of these different things. And again, part of it is us trying to be responsive to you all, because these are the things that you guys have asked for. Health and safety waivers have changed just drastically to how it was, even 5 years ago. The closure of the developmental centers really lit a fire under DDS to make sure that they had opportunities for people to be able to get more personalized services to meet their individualized needs, and that the money would not be, an immediate barrier to that. And we could look at doing some of those health and safety waivers a little bit quicker. Okay. So that being said, I guess between Jordan and Olivia, should we look at right about the beginning of May or so to maybe start looking at presenting that health and safety waiver stuff? That could be for a May provider advisory committee meeting, or it could be at a May, coffee with community services. But I know, Garrett, that was one of the questions you asked. When are we going to be getting these when's that health and safety waiver stuff? We can certainly share our little one-page primer, but the presentation stuff, let's wait until we get our new staff going, we get our plan developed and sent off to DDS, and then we can present it to our service providers. So that, because I think, part of this is, talking to for example, the charges, talk with our Spanish speaking service coordinators. What are ways in which we can increase service utilization for the clients that are on their caseloads? How can the health and safety waiver process be utilized to do that? That's also one of the requirements that DDS put out as well to do that. And so it's important to get that feedback. And I think getting it from our service providers too, ways that you might think that we can increase utilization by folks that have traditionally not highly utilized a bunch of the services, is also helpful to us. So stay tuned with that, and we'll give you additional information. But we won't make you wait, I think, all the way till May, though, to get the little one pager. I think we can probably look at getting something like that a little bit earlier.
Definitely.
All right. Jean, we got vendor forum coming up.
Yeah, we have the EI vendor forum that I mentioned previously. It's still on calendar for Wednesday. March 23rd from 2 to 4. So that's still on calendar, and that's what we have currently coming up.
Thank you, Jean. Alrighty. So we mentioned to folks, and you guys have seen it in this meeting, that we do have a regional center newsletter now, and we are gathering the copy material so that we can get ready to release our next edition of our newsletter for the month of April. And as we said in the previous one, this is going to highlight a lot of the self-determination activities that the regional center has been doing. Hopefully give folks a very good picture of, you know, we have a self-determination advisory committee. You guys certainly have seen some of the efforts of that group in the presentations that you guys have received here related to self-determination and working with the FMSs. And so just that'll be kind of coming soon. We do have another featured artist as well that we will be featuring, which is someone that I'm certainly familiar with. And so I'm excited to see how that's all gonna look on our website and look on our newsletter and everything else. And that's our plan, to just continue doing that. We're just gonna continue focusing on our clients and you know, really promoting the work that they're doing. One thing that's nice about doing this with artists is that everything is, you know, on social media now, right? And people have ways to be able to buy and sell things online. And so it's nice, again, for us to get the word out about the activities that our clients are doing. All right. Again, we mentioned PPE, but I did want to just bring up about test kits and test kit, COVID-19 test kits. So I would certainly like to acknowledge the folks from UCP that are here. And Jim's here, and Eric's here, and I don't know that Brandy's here, but you guys have quite a team over at UCP. We had a situation where the community care licensing department, who was supposed to distribute COVID-19 test kits to about 800 facilities in Sacramento County, lost their location of where to do the test kit distribution. And so Alta said, well, you guys can do it. And they said, oh, we're doing it on a Saturday morning. And so on a Saturday morning at 6:30, we opened up our building a couple weeks ago, and CCL staff gave out test kits to about 400 facilities. The issue is that there's 800 facilities in Sacramento County and not 400. And so that meant that there was 400 more facilities that had to get their COVID-19 test kits. And one thing that I have experienced is that for residential service providers, with staffing issues that were going on in the last month, sometimes people can't leave the house and go and drive even to go pick something up. It is really, really challenging. And so I would just certainly want to recognize the UCP staff and the drivers that showed up for an entire week long every morning and picked up test kits and delivered them all over our catchment area. Well, I would say all over Sacramento County, and there's facilities all over the place. So you know, again, Jim helped coordinate all of it, and Eric and the whole staff have all been really supportive of that. And you know, these efforts started previously, right? We worked with On My Own, we worked with STEP, we worked with In Alliance, and they really helped get the test kits out there. But then we were presented with this challenge with community care licensing, and these are not all Alta facilities. I think Alta's only got what, 300 or so facilities in Sacramento County. So you're talking about so many, you know, RCFEs, the residential care facilities for the elderly, the, you know, the assisted living facilities, like just the social rehab facilities, the crisis residential facilities that mental health uses. The UCP drivers went to all of those places, and they actually had to deliver them. They couldn't just leave them either, if I remember correctly, too. They had to actually deliver them to a person that was there. So, you know, thank you guys very much at UCP for all the work that you guys did with that. It was so great being able to interact with the drivers. And when we do so many remote type things, it's nice to be able to interact with people and be able to give things to people. And so, you know, those drivers every morning showed up like with just such a good demeanor. They were just so happy about the things that they were doing. And it really made me also kind of energized me as well. I tried to get down there every morning with them while they were picking up the stuff and doing the deliveries. So again, just wanted to certainly recognize you guys for your work on that. And, you know, that we know that COVID test kits. Yeah, absolutely. I will put my hands up like that and do a little clap there. Yeah, very good. Really appreciate it, guys. Absolutely. And you know, now DDS and CCL, they're trying to figure out where who didn't get their test kits, who did and who didn't. And it's tough because they delivered to facilities all over California, the different CCL offices. So logistically, it's a lot of work. But you know, that's what you guys do. Like, you know, you service providers step up in situations like this. So it was also cool, you know, also for a whole week to see all the UCP buses out in front of our office. It just made things a little bit more lively, you know, down there. So anyways, thank you guys very much for that. I like sincerely appreciate it. And you saw the emails from Community Care Licensing. The director of social services, Kim Johnson, was out there during the giveaway on that Saturday. And Kim Johnson runs a very large department. The Department of Social Services is about 5 times the size of the Department of Developmental Services. And she was out there lugging boxes of hand sanitizer and putting them in the back of people's trunks and doing everything else. So when you get the newsletter, you'll see some pictures of some of these things that went on. You'll see the pictures of, you know, on my own staff loading the boxes into the back of their, well, I think it was a little van or something like that they had, or a little bus minivan or something like that they had. So anyways, continue to just really thank you as a community, especially, I'll be honest, some of you larger providers that have really made efforts to support the smaller providers that are in need of these things as well. It's great, and I really appreciate it. And I think our whole staff does as well, because that means that our clients are going to be able to have service providers, because if people can't test their staff and people have symptoms, there was some real concerns about staff shortages. And Olivia and I thankfully have not gotten any more messages from providers saying we have to stop doing services in person because we don't have test kits. And so that is, that's certainly very encouraging to us. I was told that I need to provide an update about alternative services. And I know that we've got some client services managers in here pretty soon, and not too long from now, we're going to be thinking about rollover, right? And we're going to be thinking about, you know, are these alternative services authorizations that we've written through June 30th, what's next for them? I will tell you I have not heard word one that effective June 30th, the alternative services billing will end. I have not heard that at all. I have not heard that it's going to be extended either. There has not been a lot of comments about it, but we certainly have not been given a heads up like, hey, you need to be prepared in order to, you know, maybe see these ones go away. It may well be that they're waiting to get the rate study stuff kind of implemented, and then they're going to kind of swing back to alternative services. It is many of the same people over at DDS that do these, you know, type of things. So with that being said, as of right now, sorry, I wish I had a better answer and I could give our case management supervisors at least the heads up that, hey, they'll go through September or whatever else. But I think that's going to be our goal, is to extend the authorizations as long as we possibly can. If we need to end them early, like, we can look at doing that, but we don't want to end up with situations like we had a year ago, where we had a change to alternative services and then a bunch of you guys didn't have your authorizations in place because we were doing them like so short. For us, it's much easier to kind of go back and cancel those as needed. Shirley, hand up. Yes, go ahead.
Yes, I've had several vendors reach out to me this week, assuming that the alternative services ended April 1st because of the rates being implemented April 1st, and I've assured them what you just said. But I just wanted to let you know that I think there's maybe a little misconception floating out there. Somehow people have an idea that, you know, that's when it's going to end because of the rate studies increase.
Well, with a lack of direction and information, people are kind of left to thinking that, right? And so we're going to try to get some direction. We're going to try to get some information from you all from DDS related to that. I think Iqbal and I will both reach out to DDS to find out if there's anything. But as of right now, we have not heard anything. And again, our commitment is we want to continue these as long as we can so that we don't end up having a situation where we have a bunch of authorizations that don't get written, and then we have a bunch of kind of back and forth concerns with planning teams as to whether or not, you know, the services should be offered or not. And so we'll certainly share more with you about that as we move forward. And with that being said, that is, I believe, the end of the agenda items that we discussed. And I would look to Jordan and to Jean and to Olivia to see if they have anything further. And then I would go to Johnny as well as our Associate Client Services Director. Is there anything else, Johnny, that for the good of our group here? I know you came on a little bit late, but anything else that we might want to share?
No, I can't think of anything else, John. So,
All right, well, then all it is a good weekend to everyone, and we will look forward to seeing folks next week. And take care of each other, and we'll see you soon. Okay.
Thank you.
Bye, folks. Have a great weekend. Okay.